It'll always be freedom.
Hi, everybody. This is Miranda again. I am here today with Adam Bigelsen. He is a repeat Anarchapulco speaker, and in my opinion, what he talks about and what his family offers is one of the most important things out there you can do in regards to your health, which is getting more valuable information in a fairly painless way. So let's just start and see how you are. How you doing, Adam? How was your holiday season?
Excellent. It was full of the vibration of celebration, which is nice. A little bit of crazy with family drama, which is typical, and that stuff too, but all awesome.
Yeah, that's really good to hear. So first, I want to talk about, because I know you're in Mexico like I am, and I went to visit you this year and got to see a little bit of, the area, although I stayed longer than expected. That's a story for another day. But so you're in the Chapala area, and I want to ask you what brought you there and what do you like about it? Would you recommend it to other people?
Cool. Yeah, good question. Chapala for us was a little unexpected. Right before pandemic, I was living in Spain, which was awesome. And then my brother and I were both living there. We went to visit our mother for her birthday in California, and the lockdown happened. So we never went back to Spain. Eventually, I ended up in Tijuana, Rosarito area, which was unexpected as well. A little, as we say in Mexico, un poco loco. Tijuana's a little crazy for those of you that know about Tijuana. But at some point, one of my friends from Seattle, a senior couple, invited us to Chapala to visit and bring the microscope. And we came to Chapala, and it's awesome. It's definitely more beautiful than Tijuana. People don't usually use the words Tijuana and beautiful together. So we came down here, and, there's a big community of Americans and Canadians, which is nice. So I can speak some English, which is awesome. Cost of living is awesome. The weather is awesome. The local people are awesome. The food is awesome. So it's a nice place for us to be. Unexpected, but definitely happy about being here. And I would definitely recommend it. But you visit first, just in case. Yeah,
visit first and be careful of the police. I won't get too much into it, but be careful of the police. Watch out.
Yes.
But it was beautiful there. It was super pretty there. And yeah, there are a lot of Americans, which for me kind of caught me off guard because I'm so used to being immersed in Mexico with Mexicans and just surrounded by Americans and Canadians. That was a little surreal, but it is like, and for people who don't know, Chapala is about 45 minutes to an hour away from Guadalajara on Lake Chapala, right next to Ajijic, which is where, they're pretty much the same thing. They're kissing each other basically in terms of where they're at, but really, really interesting place to be. And, a cool place to get a blood test from you.
Yes. True, too true. Yes, definitely.
So on that same track, I want to know, what is your favorite thing about living in Mexico?
The freedom. It's for us with the work we do. My dad was very famous for his cancer work. And one of the reasons is, I love this, one of the reasons my father was able to cure cancer was because Mexico allowed him to do it. In the United States, my dad got in trouble for that. He was brought up on charges of curing someone illegally. So the head of the medical board say they didn't even care if the person got better, right? Mexico, they kind of care about their people. And we had some friends. The one clinic my dad worked at, the guy was very connected. He was friends with one of the ex-presidents of Mexico. And so, we live in a gray area, more or less, in the United States, but we came to Mexico, and Mexico said, look, if you're going to bring people here for the medical tourism, we're thrilled. Do not hurt anybody. If anyone has a bad experience, we're going to have a problem. So for us, the freedom, I'm allowed to do what I want to do. It's a little bit of the Wild West out here still, which is a good thing and not, depending on where you're at and what's going on, for sure. But it's been great for us. We can say things that we want to say here. There are some resources here for us. There's an osteopath in town, was actually trained by the guy that worked on me when I was 12, which is awesome. So unexpected, even for my dad, though. My dad said, you're not free in the United States. So as soon as you cross the border, things are a little different here, for sure.
Yeah.
So that's what I like.
So tell me more about that, because I know a little bit about it, and obviously I've been there and had a blood test, but tell me about your dad and tell me about how holographic blood and how that all came about.
Sure. Dad, my father was an interesting guy, very, very intelligent. When he was in fourth grade, they had him take a math placement test. And they told him to do the test on page 44, and he did the test on page 444. And he got 100% without showing any work. So his brain was very, very high functioning. And he went into medical school. He wanted to cure cancer. He said this to my grandmother when he was 8. He said, I want to cure cancer. So he went to medical school. He became an eye surgeon. His pattern was interesting because as he was in school, he would ask questions and they would tell him to read the book. And he would say, I think the book is wrong, but they didn't really want him to ask questions. He got drafted to Vietnam and he noticed there some interesting things, the lies of what our government tells us about what's going on there, seeing things firsthand. But he saw what went on in Vietnam with his medical experience, that the hospital he worked at in Vietnam had a 98% survival rate. So during a time of war, they were having better survival rate than people in the United States in hospitals with no war happening. So Dad questioned his schooling, he questioned his government, he questioned a lot of things. And as he questioned things, he got different answers. When he was in the United States, he was a rich eye surgeon when he was young. And he said he had had everything he'd ever wanted, and he was near suicidal. Having all these things, that wasn't what he wanted to do. He wanted to help people. So eventually he found a way to help people, and he was thrilled. And as he was an eye surgeon, at one point, someone came to him for a consultation. And he recommended surgery, because this is what he was taught. And the person said, thanks, I'm going to go try this new alternative method. And Dad said, okay, whatever. But the person got better. And my dad was very interested in what went on. How did this person get better without the surgery? That's all he was taught. So he learned this technique that this person had done. A simple technique, the retrobulbar injection. They move the eye to the side, and they have a curved needle where they injected some natural remedies behind the eye. And the person got better. So Dad, as he's working with people, someone comes into his office not long after, has the same issue, and he's super excited to try this new technique. And he did the technique, and the person got better. And he was thrilled. The person was thrilled. This person had been to 5 other doctors who could not fix her. So when Dad fixed her, she went back to those 5 doctors and said, I'm better. And every one of those doctors turned my dad into the medical board. They were not interested in what he did at all. All they were interested in was the ego experience of, we didn't do it, he did it, and he didn't do it in a way that we like. So this was not the first time my father got in trouble for helping people. As time went on, the blood thing experience was really interesting. He was in Arizona as a homeopath, and in the 80s, anyone could call themselves a homeopath. There's no certification for it, things like that. There's no consistency. And he's doing good things, but at one point I got sick. Right before I'm going to college, a week before college, I get mononucleosis so bad I'm showing minor signs of hepatitis. And Dad had just visited Gaston Naessens, for some people listening may have heard that name before, a very famous physicist in Canada that worked with this microscope. So Dad saw this microscope. He saw things living in the blood, which he had never seen before, because Western medicine stains the blood. They do not look at live blood. My dad was the 3rd doctor in United States history to look at the blood live. All right? Rel Rife is a name people know, then Virginia Livingston Wheeler, then my father. He's had a lot of experience. But after he first saw this microscope, his mind was blown. He came back to Arizona, where we were living, and then I got sick. So at that point, he somehow found a German doctor that was living on an Indian reservation in Arizona that worked with the microscope. And it was interesting because the Native Americans there, they called him the Great Spirit. And this guy actually flew in the Luftwaffe. This guy flew in Hitler's Air Force. All right? So you now have my dad, who's the nice Jewish doctor from Brooklyn, New York, with the ex-Nazi from Germany working on me, right? And I remember the guy took my blood, he mixed it with some remedies, this huge syringe. He had me hold it in my hand and think happy thoughts. He shot it with a laser, and then he injected my tonsils, big long needle. I couldn't breathe. So at that point I was like, just cut my head off or put a hole in my neck so I can breathe. But he injected my tonsils with most of the remedy, put the rest in my butt, and said to my dad, your son's going to be fine. He can go to school. And the next day, my swelling came down, the coloring of the tonsils changed, my white blood cell count went down miraculously, and 6 days later, I went to college. No problem. So Dad got that German guy to come in and work in his office. And it was interesting because this is still 80s, right? And when the German guy's working in the office, Dr. Friedrich Ploeg, all of a sudden, Farrah Fawcett and Ryan O'Neal, like the cast of Dynasty in Dallas, are coming to the office because they know this German doctor. They follow him around, and when it's award ceremony time, he does regenerative therapy on them and makes them look young and pretty. So Dad is realizing something's going on with this guy here. But the guy didn't share a lot. Dad studied his medical readings after work and things like that. And eventually the guy left to go back to Germany when the Berlin Wall came down. So Dad felt lost. There's no one to show him. He's got a microscope now. And strangely enough, a random person walked in our office and says, I am here. This 4-foot tall German woman with red hair and high heels and a big cape and a diamond encrusted cigarette holder, right? I am here. We don't know who this person is, but she does the microscope work as well. So she worked with my dad. Dad didn't believe what he was seeing. For about a year, it took him to really understand what was going on, what she was seeing in the blood. And we actually hired private investigators to find out where these people learned from, and we couldn't find out. So we're pretty convinced that these people were, Germans. The age was right during Holocaust. Were they experimenting on my Jewish relatives? Because we know that stuff was happening during Holocaust. But in the end, Dad saw this for a period of time. The patterns made sense to him, and then he started to do it himself. So it's an interesting story. It's a bizarre story. Every once in a while we try to look these people up, and there's really nothing out there on the people that taught my dad. And at this point, we are the only ones in the world who do what we do. There's a lot of people, Miranda, that know about live blood analysis.
Yeah.
Live blood analysis, it's a brand. It's nutritional microscopy. So we analyze the blood live, but we do not do live blood analysis. So it's a little confusing for people, right? But so yes, we do holographic blood analysis. We see holograms in the blood that represent imbalance or what your body's concerned about.
Yeah, I was going to ask about that because we do have somebody coming to Anarchapulco this year that her name's Anita Baxis, and she's going to be doing the live blood analysis.
Oh, that's too bad. Sorry. Ho'oponopono. Yeah, interesting.
Yeah, because I was like, okay, I was like, well, that sounds different than holographic blood, but I'm obviously by no means an expert. I have a little bit of experience having had a holographic blood test myself. So that's really interesting. So what exactly is the difference there?
This is a good question. What's the difference? Okay. So live blood analysis, like I said, it's nutritional microscopy. So they're going to look at your blood, and I know where the work comes from. I had a doctor that worked with the person who developed it. So I know a lot about it. And I'll be very nice. So, yes, for those of you listening, you may have heard my brother and I say all kinds of things about this. So what happens, though, is a drop of blood is taken. We take similar thing, capillary blood, drop from your finger. And then they're going to tell you, live blood analysis will tell you your red cells, your white cells, the platelets, plasma activity as well. But very similar images, very, very different interpretation and philosophy. All right. So, for example, when we looked at your blood, we see these little things moving around in the blood, right? Mm-hmm. These symphritites, the microzymas. Wilhelm Reich called them bions. There have been many different names for them. Western medicine says they're fat particles, which they can be. These things actually help us to create who we are, and they help us to decompose. All right. When my dad visited Gaston Naissans, he isolated one and injected it into a dead rat muscle. And 30 years later, that rat muscle was alive in a jar. Like, this is pure life. They found these little things in limestone, millions of years old. We've seen them in the soil, in the grass, and the animals. They're everywhere. All right.
Those were like the little white dots, right? That were kind of wiggling around. Yeah.
You got it. So this is like your life force, your chi, your prana, the force. Okay. This is the essence of who we are. These things never die. All right. So I know when we die, part of us lives on. This was really interesting. I know for a fact part of us never dies. And I love that. So live blood analysis says these things are fat particles. So if you eat a bacon cheeseburger, there's more in there. Okay. If you eat a bacon cheeseburger, depending on the reaction, you could have more in there, but they're not fat particles. So very different interpretation and philosophy. The other thing too is live blood analysis is designed more or less to see certain deficiencies and things in the blood. They'll tell you all these different names for different types of red blood cells. For us, there's only one type of red blood cell, but it decomposes different ways, is one thing. But then there's a supplement with live blood analysis for everything they're seeing in the blood. All right, for us, we've never done supplements. Supplements do not fix things. They are a Band-Aid, okay, which is great for you to use as you're managing. Like, we don't mind putting a Band-Aid on the dam while you get to the back of it and fix where the leak is really coming from. Mm-hmm. All right? But very, very different interpretation of philosophy. And for us, it's a little bit of it's very frustrating, actually, as we've seen over the last few years, what people have done with these images. All right. For example, there are people that are sharing the same images I've seen for decades and saying they just came across them now, and it's hydrogel, or it's graphene, or it's nanotechnology. And they're wrong.
Websites and all that stuff, yeah.
Yeah, I have seen the same images for decades, okay? But what's very interesting is, us. We're a very small operation. I have difficulty keeping up with my emails and things like this. We don't make a ton of money. There's another reason I moved to Mexico. So we have people that have teams of marketers, and funding and things like this. And it's, we're not here to compete with anybody. But the live blood analysis confusion with what we do has been frustrating. The world knows of live blood analysis. You can usually do it for $50. Sorry about that. Like I said, you'll get some supplements. We teach, as Josh and I teach, we don't teach the blood anymore because we have seen what people have done with this work. All right? People have no idea what they're talking about and just making guesses and not even listening to other people. There's no discussion. Over pandemic, I tried to reach out to a few people and they were not interested at all. And they have 50,000 followers on Instagram and things like that. And I have 400, so it's a different experience for sure. I think that's cool that you'll have a live blood person there. People can experience it. They can hear what we're talking about. I guarantee you, anyone listening and watching, if you've had live blood analysis, they tell you have parasites, you need to do detoxes. Okay? So in our world, and you know this, parasites are there to do a job. They're there for a reason. All right? If you have parasites in the garden, the worms come and they clean certain things up and they fertilize. But if you have an over-proliferation, if you have too many, there's a problem. And for us, we're never going to kill your parasites. They're there because there's food. I just did a song not long ago, Parasite Party. You want the parasites to leave the party, you take their food away. All right? If you kill the parasites, they're just going to come back because they're there for a reason. So really, I love what we do. It's simple in a way, not to necessarily do the work itself, but one of my dad's conclusions about health was, health is simple, but people are complicated. We make life too complicated. If we can simplify the experience, life is a whole different story. So that's my job. I look at a drop of blood. We did this with you. We look at the history. We look at your blood. We see physical issues. We see energetic issues. We see emotional issues. All right? And they all affect each other. Okay? We're emotional beings. How often we've seen, and actually, Dad's conclusion with chronic disease, cancer especially, was it was 1,000% triggered emotionally. So all my dad's liver cancer patients, there was anger. All the lung cancer patients, there was grief. This aligns with Chinese medicine, which is thousands of years old. So what we do, I love it because it's very consistent. What we do, Josh and I, when we lecture, when we do the presentations, when we do the consultations, we tell people, what we are here to share with you are things that, not what we think, but what we know from repeated experience. My dad did this for almost 4 decades, okay? If anyone listening knows of anyone that's had as much experience with the microscope, dark field microscope, as that, I'd love to meet them, okay? Not the famous ones, because we know them and they're all doing live blood analysis, so I'm not really interested in that. But for people like you, for the average person who has something going on, when we looked at your blood, it made sense, didn't it?
No, it really did. It made a lot of sense. And I share it, like, I talk a lot about my experience getting my blood tested through you guys, because it was, and we were talking about it. I just did an interview earlier with Bodre. She does body work at Anarchapulco. And I was talking about, what I had seen there, because I went in there expecting to see a lot worse. But most of what we saw was structural issues and emotional issues and inflammation. And to me, that's all manageable, it was really cool to see and to, have validation for things that I knew were happening. Like, we saw my cervix in there, we saw all sorts of, specific things, but like, it was really cool to see it. And it made sense looking at it and seeing it identified. And I think the cool part about it at the end wasn't, okay, now here, buy this thing. It was, well, here's some things you can do, which I'll ask you in a second to kind of explain some of those things, and just go for it, And it's like, me personally, I agree with you. I think everybody should have at least one of these tests in their lifetime. It's really interesting. Like, it's really interesting to see, and to see the changes. We did that second one and you could see that structural thing breaking apart. Like, that was
awesome.
Cool.
Yep.
And also, my happy little blood cell, my little white blood cell, the literal smile face on it. Like, that was unexpected, but it was really cool and really special to be able to see everything kind of moving and floating around.
Yeah, it's nice to be able to do an interview with somebody that's gone through this experience with us. For us to look at the blood, there's no secrets. You can lie to us if you want, but we see. And my brother and dad, they had this technique that was funny. They'd ask someone a question, and say, "Oh, emotional with your mom?" And the person would say, "No, I'm always fine." And then they'd say, "So emotional issues with your mom?" Like, they would say the same exact question again. And then the person just starts crying. We lie to ourselves all the time, right? "I'm fine. Everything is fine." But the thing is, we put the blood on the microscope. We don't alter it. We do nothing. We put it there. We turn on the microscope, and then you get to see it. And for me, it's you. There you are. There's your blood. And all we really do is translate what your body's trying to tell you. And you knew these things. Mm-hmm. When we look at your blood, we see things that you knew, we see things you forgot about, and we see things that, you had no idea they were related to what was going on with you. Mm-hmm. But that's what's nice, is when we look at someone's blood, there's no beating them into submission, convincing them, saying, well, we're the experts and you just don't know. It makes sense to the individual. And so often it's validating. I thought my knee had something to do with my stomach issue. And it's so interconnected, it's bizarre. That, you could have something going on with a scar on your foot that's affecting your neck. We've seen these things. My dad treated the woman couldn't turn her neck, and he treated the scar on her foot, and she could turn her neck. This is true integrative holistic medicine. And what you said about the structure was cool. For us, this is one thing we hammer on the structure as far as getting people to align their damn body more than anybody. Okay? I know so many people. I know the famous energy workers and the famous emotional people, and the spiritual people. And people miss the physical experience. Your physical structure is the supportive framework for your energetic flow. Right? So if your car is out of alignment, you can put all the good gas in it you want, all the oil changes, but it's going to keep driving off center. You need to align the damn car. And most of us will align our car once or twice a year, but we never align our bodies unless we get hurt. Mm-hmm. We fall, we go to the chiropractor, we're out of alignment, he puts us back in. All right. So many times, digestive issues, people changing their diet, right? And we look at the blood and there's the structure. Everything's twisted and tweaked. Well, if it's twisted and tweaked, it's putting pressure on the organs. All right. So if you think of a hose and things are trying to go through the hose, liquid, and you bend the hose and it's crimped, nothing gets through. Well, you can thin out the water, change your diet, eat different food, or you can uncrimp the damn hose. Take the pressure off it. It's amazing how many times heart palpitations freaks people out, okay? Your heart starts beating irregular, you're going to freak out, right? Well, then what do? You go to the doctor, and what are they going to do? They're going to do a bunch of tests, which are stupid, and tests are not, actually the tests aren't stupid, it's the interpretation of them, right? Most tests can be decent, but the interpretation is ridiculous. But then they're going to cut you open. They're going to do hard stuff on you. I had a friend, and our father knew him. It was funny. My brother and I are hanging out with him at the beach, and he's having heart palpitations. He's freaking out. And we call Dad, and we say, hey, what do you think? And Dad says, oh, I know him. He's a golfer. Yeah. He says, have him take his shirt off and check out his nipples. I was like, when's the last time you asked one of your friends, you take off your shirt so I can check out your nipples? So take off his shirt, and they're totally lopsided. He threw himself out swinging his golf swing. So as he's crooked, there's pressure on the heart. So we send him to the osteopath, not the chiropractor. We like the not forceful manipulation, who aligns the body, takes pressure off his heart, and his heart palpitations go away that quickly. I know people that have pacemakers because of heart palpitations when they could have gone to the damn osteopath. One drop of blood. Right? My dad learned so much about a person from one drop of their blood, to the point where he didn't have to look at my friend's blood. The patterns, this is it, Miranda. It's all about the patterns. And we've seen patterns over decades. Health is simple. Align that damn car. You got to work with scars, adhesions, because they're pulling on you. They're pulling in different areas and directions. You have to work on the teeth because they transmit energy and they affect the structure. How many people have mercury on the tooth that is the thyroid meridian and have thyroid cancer? We've seen this a lot. And they remove the mercury from that meridian and the cancer goes away. Interesting, isn't it? Mm-hmm. So structure is a big deal for us. And for how many of you guys listening even know what an osteopath is, right? Right. Find one, support them. We need more of them. They're disappearing. All the medical schools in the United States were osteopathic before Carnegie and Rockefeller. So there was something good there.
Yeah, I didn't necessarily know what an osteopath was before all of this. And yeah, you mentioned the scar thing. That was the thing that was really kind of interesting. And I went to your practitioner that you had recommended there in Ajijic before I left. And I'll just tell a bit about my experience first, and then I'll ask how you guys kind of came to that, because it's and I've talked to a few other people. I talked to an osteopath I found here about it, and he's like, they did what to do what?
Yeah, who?
But he was interested. He was very curious. But basically, this woman injected, I don't remember what it was, but she injected this solution around my belly button. And then all of a sudden, I started feeling this tingling in my ear, which I had a jaw injury, a very famous jaw injury. And torn ear canal, and I started feeling this tingling, almost like there was water running or something in my ear. And I told her that, and she's like, "Well, do you have an injury there?" And I'm like, "Yeah." And she's like, "Well, it's working on that scar." And I'm like, "But you injected my belly button." And she's like, "Yeah." And I could hear a little bit more evenly after that. And it was just
crazy? Isn't that crazy? It's like, this is crazy, but it's all connected. When she works with the belly button, the umbilical ligament is attached to the roof of the diaphragm and the pubic area. And when we're born, especially in the United States, they pull the umbilical cord and they cut it close so you have a pretty little belly button. Mm-hmm. For most of you guys listening, if you have an innie, I think that's the medical term for the belly button that's deeper in, it's attached to the roof of the diaphragm, okay? And this is interesting. So they pull it out, it pulls the diaphragm down and the pubic area up when you're born, so you're very malleable then. And they tie it tight, and then as you grow up, it's scar tissue. So it pulls down. This is one reason we lose our height as we get older, because of the belly button. All right. But the other thing is, this is like clockwork. This is what my dad learned from the microscope, okay, and observing patterns. If their belly button's too tight, as you grow up, the diaphragm gets pulled down, and eventually it puts pressure on the liver. The liver can back up, and then when you're around 13 to 15 or 16, you get mononucleosis. When we look at your history form, if you had mononucleosis, we know your belly button was tied too tight. And if it's tied too tight, you're never going to get that full breath. For those of you guys listening, if you have asthma, I used to have asthma, okay? Dad did the belly button treatment on me. This was one of the first things he did. And I can take a deeper breath than most people I know. And, I'm these days I'm much healthier, but as I was younger, lots of smoking and things like that in high school and college. My brother, not doing that because he was a jock, I can take a deeper breath than him, all right? Oxygen's important to us. The other thing with the belly button is interesting because if your belly button's too tight, if your jacket is too tight right here, you're going to feel it pull on your back. Mm-hmm. So lower back pain is a chronic disease, guys, and here's a cure for it, depending on what's going on. Not 100%. We release that scar from the belly button, and we do the diaphragm points also. Now you can get a deeper breath. You get more oxygen. Disease can't live in oxygen. You stand up straighter. Cerebral spinal fluid flows much more evenly. That's important. It's nourishment for the entire body. But then the lower back pain goes away because there's not pressure there. If I tuck my shirt in too tight on the right side, I feel it here. Mm-hmm. It's the same idea. The front's too tight, you feel it in the back. And everyone is going to the damn chiropractor to work on their back. The back is the result. So that's what you had done. And this is one of those things, Miranda, when they work with the belly button, emotions get locked in the body physically. This is your birth scar. So sometimes people have this belly button treatment, they start crying about their mother, like the emotions come up. And it seems crazy that she worked on your belly button in your ear. But if this is tight, it's going to affect the flow of everything. Mm-hmm. Loosen this up, and all of a sudden there's more flow. Yeah, once again, I love what we do. It's simple, more or less. What did she do with you that day? She injected your belly button, the 5 little diaphragm points, and then just did some gentle work on you, right? Mm-hmm. Yeah. Nothing forceful. And you felt change in different areas than where she was working. That's pretty cool. And then your blood changed. This is what we do too. When we had the clinics and Dad was alive, you would come to the clinic, we'd look at your blood, we'd see the imbalances, the structural things, the scars, the adhesions, we'd see emotional things, energetic things, and we had the people there that would do the work. My dad, our last clinics, Dad wouldn't even touch you because he gave up his medical license. You would stick your own finger because in California, if we stick your finger, that can be considered assault. Right? Yeah. Actually, in California, they can put your grandma in jail for telling you to drink chicken soup when you're not feeling good because she's practicing medicine without a license. But we would look at your blood, do treatments, and look at your blood immediately afterwards. Because if we do the right treatment, the blood will change immediately. And you got to see this, which is awesome. We don't get to do this very often anymore because we do these distance consultations. People send the blood in. We try to help them find people in their area. But for us, what we know with true science is a small change in a biological system affects the greater whole. So we look at your blood. If we can change your blood, we know we can change you. But the bottom line is we want you to feel the change. So you got to have the treatment. You felt some interesting things. Mm-hmm. And then you got to come back and we took your blood and you got to see your blood change. If you had not had the right treatment, your blood would have looked exactly the same. Mm-hmm. And tell me this, you did see some similar things, but like you said, you saw the one image, but now it was breaking apart.
Yeah, it was like this big white mass and it had white blood cells on it and it was fractioned into a few pieces. And that was super interesting to see because like we were more or less seeing the same shapes in the blood. And you would think it's like one drop of blood, it's a different drop of blood, you're going to see different things in it, but it was more or less the same things.
Yeah.
With slight differences of things being actively, obviously worked on.
Right. And those little changes, that's what we're looking for. All right. When we see a solid image in the blood of the sacrum, let's say, then the body worker works on you. Afterwards, when we look at your blood again, that image either needs to not be there or it needs to change. If the image hasn't changed, then the person didn't get the job done. And this was when Dad had the clinics, you paid one fee flat fee, okay? You were there for an hour or sometimes 4 hours. And what Dad would do is look at your blood, do the treatment, look at your blood again. If he didn't get the reaction he wanted, he would continue to work with you. You paid for the result. We didn't nickel and dime you for every little remedy and everything we did with you. We needed to get your blood to change and you to feel some change. So that was his deal. It was really nice that he, when he was an eye surgeon, we were rich. I remember this. Josh and Lila, my sister and brother, don't remember so much because they're younger. We had the Porsche and the Jaguar, and we didn't have art on the walls. We had artists paint on the walls, right? Like my dad had money. He was a rich eye surgeon. And we moved to Arizona, and he found this way to become a homeopath in natural medicine. And we had a Blazer and a Datsun. And like my mom says, there's a story of me saying, I want this. And she said, we don't have the money. And I said, just go to the bank and get it. Like I didn't understand that now we have a lot less money. But my dad, we learned through my dad the difference between being rich and living rich. And I remember him as I grew up in Arizona, him coming home so excited about what he was doing. This person came in with this, and we tried this, and this happened. Like he really was thrilled. And it wasn't about the money. He really was rich being able to help people. And then, like I said, too, his history, he was so excited. He did very well. Arizona was the first state that had a law that separated the American Medical Association from the American Holistic Medical Association. And my dad wrote that law. He created the American Holistic Medical Association, which is still alive today in the United States. And it took power away from the American Medical Association. In the United States, you have homeopathic medical doctors. And depending on how old they are, they may have my dad's signature on their license. He gave out the first homeopathic medical licenses in the United States. So what he did was he legitimized homeopathy. He made sure that homeopaths had some anatomy background. He changed medicine in the United States, and that did not make the AMA happy. He had the book that came out, which is awesome. For those of you guys listening, read his books. Doctors Are More Harmful Than Germs is a great book. It did not make him a lot of friends in the medical industry. That's for sure, right? They were not happy about that. And if you poke big industry people, sometimes they smack you. So his clinics were shut down. He was brought up on charges at one point of illegible handwriting as a doctor. And the judge said, this is a joke. My dad said, I learned that in medical school, how to do a quick signature because I was going to write so many prescriptions. And even for me as a kid, when I was in elementary school, my teachers would say, your handwriting is horrible. And I would say, oh, my dad's a doctor. They would laugh. It's like a joke. Yeah. So my dad brought up on charges of curing someone illegally and illegible handwriting as a doctor. All a joke. Yeah.
Wow.
That's yeah. I was just looking, it was funny. I was just looking for your consultation report. We could talk more about that. No pressure.
I mean, we could, I mean, I'm kind of an open book. We could show the photos if you want, because that was so cool. I did give you hosting access so you can show, but like, it's one thing to talk about these images and it's another thing to actually see, what these things look like. Because for me, I had a very, very vague idea of what holographic blood meant. I just knew that Rebecca was like, here, take my car, go to Ajijic, do this test. And I was like, all right, let's see what happens. And
right. She's serious if she says, take my car, right? Yeah. Well, and it's interesting, like I said, it's nice to be on with you because you have had a consultation. We've been on with a few people that have had the consultations with us. So we can really speak to that experience, which is nice. And I got to tell you, you look awesome today. You look great, as I haven't seen you in some time. I wish as we did what we do or do what we do, we would take pictures of people so we could show them like, this is what you looked like a year ago. This is what you look like now. There's changes, even symmetry in the face, is a really interesting thing. So you had one treatment that wasn't a huge deal, but actually that treatment can continue to affect you for a long period of time. This is one of those things that we've been tied up and tense for so long that as things start to open up, change happens. The body takes a little time to integrate this stuff. So even when you were with us for that period of time, initial reaction with the practitioner is one thing, but then noticing how you're feeling the week later, things we would have talked about had we not had such a dramatic experience with you around with our whole thing that was going on in general. But food for thought too. And, wondering too, as it's been, when did we look at your blood actually?
It was in March. It was
yeah.
March. Yeah, middle of
So
March.
March, April, May, June, July, August, September. So yeah, almost 9 months ago or something like that.
Mm-hmm.
So question for you then too. What have you noticed? I remember there was a point you went back. You went back to, I forgot what you call it, the trapeze or what you're doing.
Oh yeah, the aerial stuff. Yeah.
Yeah, and you were like, I haven't been working out, and for some reason my body is as flexible as it usually is, if not more flexible. Like, wasn't even your teacher saying something about?
Yeah, he was kind of, because my teacher, he's a little bit of I think he likes to inflict pain on us, and when we don't come for a while and we come back, he'll like make the warm up extra hard while making eye contact and just like a little smile. And I was managing to keep up, and I was surprised. And like there have been a few other times since then. Like I wish, like I do have access to an osteopath here, but he doesn't do like he had no idea what I was talking about with the scar release and stuff like that. He's a good osteopath. He does help bring things back into alignment when I very commonly pull them out. But with that, like, yeah, I was able to keep up in class way easier than usual. Whereas, there have been a few times since then where I just won't go for like a week because life is busy, and then I'll go back and I'm struggling, to keep up basically. So yeah, that's a thing. Did we lose you? There we go.
Oh, there you are. Hey.
Yep. Yeah, I think we lost you. I realized at the end of what I was saying.
Gotcha. Cool. You froze for a moment, but it says recording is still in progress, so I do all as well.
Yep,
so tell me, what were you saying? Last I heard, you were talking about your teacher inflicting pain.
Okay, so yeah, basically, I was able to keep up. I wasn't suffering too badly, and I wasn't that sore the next day. Whereas there have been times since, because I only had one of those treatments of that variety. And there have been times since where I just don't go for a few days to class because of the way life is working out. And then when I go back, it's a lot tougher because you lose strength and flexibility in these things really quickly if you go from training constantly to doing nothing. So I definitely did notice a thing. I wish that the scar release thing was more common. Yeah, because the osteopath I have here, he's great, and he's really good at getting things back into alignment. And, dealing gently with he deals with the organs and everything. But he looked at me very confused. And he also doesn't speak English, but he looked at me very confused when I was explaining to him, yeah, she injected this thing into my belly button and I felt it in my ear. And and then he was like, and I'm like, and I had this blood test, and I sent him the report, and he was like, okay, that's really interesting. He was fascinated, but he was also confused,
Well, and it's funny too, because it's stuff that people never hear, never talk about. This is our thinking is with doctors, the umbilical ligament, it's attached to the diaphragm. Do they not know these things? Why are they pulling the cord out, when you're born and cutting it so close? Why don't they look at nature? Midwives will do this. And nature does this. They leave 3 inches on the umbilical cord, on the stalk, they call it. Mm-hmm. And after a little bit of time, a week or so, it falls off. Mm-hmm. And then the child has an outie belly button, but then as it grows up, the belly button starts to go in. Mm-hmm. Right? So nature does these things. For osteopaths, body workers, they're the ones that are most interested in what we have to say because we support the hell out of them. We need more osteopaths in this world, and they're disappearing. And this is also this is true integrative medicine. Okay. When you've got the acupuncturist working with the body worker, all right, we're having at least some of those tools. We've got the dentist in Puerto Vallarta now who's awesome. I think you met her at Anarchapulco last year. Mm-hmm. She took her first cranial sacral course. So she can now work on your head a little bit, loosen things up, then work on your mouth for a few hours and beat your head up, and then work on you again and relax you back into parasympathetic where you heal much quicker. When you see her, it's a much less traumatic dental experience than most dentists. you know? So if we could get dentists to learn a little cranial sacral work, massage therapists, you're listening, get some cranial sacral training. It's not rocket science. You learn to feel some subtle things, and the job becomes really easy. It's different. So for you to go back to your training, and for those people that don't know what she does, it's pretty extreme. You know, I mean, you're upside down, hanging from a rope and twisting and spinning and climbing. This is not just anyone jumps on a rope and goes, yay, and swings around like Tarzan. So this is very physical on your body. So you're very conscious of your physical body, which is nice. So for you to know, whoa, I took some time off and I feel good. And for your teacher to, want to inflict pain and realize, she's not doing too bad. I hate that as a teacher when people don't do their homework and they still improve. But what happened though is you're less restricted. So from now on, you're going to be able to get more expansion this way. You're going to get that deeper breath. You're going to have more stamina. You're a healthier person because of this one little treatment, and it's going to affect you for the rest of your life. Scar tissue doesn't regroup. Mm-hmm. So when she worked with the belly button, she starts to break up the scar tissue, oxygen comes in, things start to open up, and the scar doesn't all of a sudden get tense again on you. So you have less restriction in your body than most people do. And most people are doing their best. Asthma, they're trying, the back pains, they're trying, but they just don't understand how the body really works, how it's all connected. Dad was going to do a book called The Head Bone's Connected to the Knee Bone. Mm-hmm. You hit your knee, you get a headache, right? You fall on your butt, you get a headache. It's all connected. And for people listening too, think about these things. If you have some physical issue, what was going on with you the year before emotionally, because we get set up for our physical issues, all right? But then noticing, we had the woman in Spain, was a friend of Anna, my girlfriend. She's in her 40s, and she's got a hip problem. And they want to do a hip replacement on her. 40-year-old is too young for hip replacement, okay? So we looked at her blood, and this was one of these things that blew Anna away. For those of you guys that don't know Anna, you should. She's a research scientist who's awesome. But we looked at this woman's blood, and we saw a scar, we saw her cervix, and then we saw the hip. So these are the clues, all right? Dad's hero was Sherlock Holmes. He considered himself a medical detective. We looked at her history form. We talked to her. Cervix, any procedures? Yes. She had, I forgot what they call it, the conization. They do something where they burn on the cervix. And if they burn too much, it creates scar tissue. And scar tissue pulls. So this scar on the cervix area was pulling on her hip. Okay? And she'd go to see chiropractors. They'd put the hip back in, and it would go out again. They put it in, it goes out, because something internally is pulling. So when we saw the scar, the cervix, and the hip, we got the practitioners. The person treated the scar, like your scar was treated. Then now there's some more movement there. And then the osteopath, the body worker, aligned the body. And after that one treatment, she never needed another treatment. She never got a hip replacement. She's out walking 10 miles a day. All right? So for people that have had hip replacements, they're not the worst thing in the world. But for people thinking about them, a drop of blood can give us a clue that can change that potentially for you. No pressure. No pressure.
Yeah, on that note, I want to know, what is the coolest thing you've seen in the blood? Because I know you told me a few things, including seeing an IUD in the blood, but what is the coolest thing that you have ever seen in the blood?
The coolest?
Yeah. The thing that blew your mind the most, that was obviously a thing, and
There were two that did this for me, because one was my blood and the other was a picture I took of someone else's blood.
Okay.
So I'll show a couple pictures real quick. Let's do this. Dun, dun, dun. So I can screen share. All right, photos. All right, so you see my blood there, my happy white cell?
Yep.
I have a t-shirt. This is my blood, my happy blood, right? So real quick, if this video works, people viewing can see the little guys moving around. These are the symbionts, the bions that Wilhelm Reich talked about. Mm-hmm. Your life force, they help create who we are, okay? They're involved with the stem cells and the exosomes and these things. White circles here, your red blood cells. The happy guy over here, white blood cell. I don't know if you can see he's moving, like there's life in there. These are both two different types of white cells in the bottom right. So up top left, about 11 o'clock, there's platelets, even way up in the corner. And then you're looking at the plasma activity. So this is the blood basics. This is what we're looking at in general with people. Then we'll see the images. And the images represent many different things. My pictures are not in order, but that's okay. These are emotions that we see, and they look like they're bubbling up to the surface. We see old emotions. We see recent emotions. This aligns a lot with Dr. Emoto's work, what he was doing with the water. And for those of you guys that know Dr. Emoto's work, what he did with the water, he tried to do with the blood first, but he couldn't do it. So when he found out about my dad's work, he was thrilled because we see the emotions in your blood. And they're a big deal for us. This one's a great image. And Western medicine says this is dirt, by the way, an artifact, right? I think so does live blood analysis, by the way. So broken femur, here's the anatomy book. There's the image in the blood. This image will show up in every drop we take until something changes there, okay? This one was my knee right here. So you got the anatomy book. I was at a concert. Someone fell on my knee at the concert. I love heavy metal. I've been to many heavy metal concerts, never gotten hurt. Looked at my blood before and after heavy metal concerts. It was a fun experiment. But someone fell on my knee, and there's my knee. This, for people wondering, this is an air pocket, and this is dirt. And many, many people have said over the last 3 or 4 years that these are COVID crystals. And those people have no idea what they're talking about. So I'm curious with your... maybe I'll get my blood done from your person at Anarchapulco. But let's show you a couple more. But so this one was me. So when you see images like this in your blood, it's like, wow, this is my body saying something. The knee needs attention, basically. Okay. My 80-year-old chiropractor in Seattle looked at this and he had nothing to say except, yep, that's your knee. And it'll be in my blood until it gets fixed. And I've had my knee worked on and it's not in my blood anymore. All right. This one, there's the nervous system, and this is an image found in the person's blood. The person had spinal nerve issues. For people watching, listening, see how small the red cells are here? Okay, those are red cells. This is a very big image. Let me remind you, earlier I said we take drop of blood from capillary. Capillaries are only big enough for one red cell to fit through at a time. So this image physically cannot be in your bloodstream. You could potentially have a stroke. All right. These are holograms. This is energy representation of imbalance in the body. It's crazy what shows up, okay? So once again, anyone that says hydrogel, graphene, any of that stuff, wrong. Wrong. As a microscopist with a family who's done microscopy for longer than anybody, my thought on microscope images these days is do not listen to anyone that shares them. Nobody. Even electron microscopy. I know someone whose mom was an electron microscopist. There's nothing there. It's all a bunch of crap. All right. I'm happy to argue with nobody about that. Argue with someone else. So this one was my mom's blood. Here's the x-ray of her spine, air pockets. And you can see the vertebrae and the cartilage there.
Yeah.
You know, like they match the x-rays. This one matches the sonogram. This one was 3 months pregnant, or 3 months? I think 3 months. And then here's the same image in the blood. It's like the body saying, hey, baby, make sure you know there's a baby here. Baby! This one was cool. This one, Fiona, some people know Fiona. She's done some interesting things with urine therapy, with the microscope even too. But she fell ice skating one day and hit her head on the ice. She used to work in our clinic. She's our head microscopist at this point in time. And she went to the hospital, and then she came to see us. And we looked at her blood, and here's her neck, and here's her head. And we could say, my dad said to her, I think you're hemorrhaging. Like, this looks like internal bleeding. And we sent her back to the hospital, and they did more tests, and they said, oh yeah, you are hemorrhaging. So millions of dollars worth of equipment, right? Things like that, diagnostics and educational people or whatever, educated people. And we saw this in the blood, and they missed it. All right. This one, there's a colon in the blood. We could tell this person still had to go to the bathroom. This is here's your COVID crystals for those of you who are interested. Air pocket and dirt. But let me see. This guy broke his hand, and here's his hand in the blood.
Wow.
Like fingers and everything, right? Just some blood, plasma activity. The dental implant. Like this one showed up. My dad said, this doesn't look natural. It looks like a dental implant. And the woman said, I have a dental implant that is killing me. So she had it removed. And then the image actually started to dissipate, started to break up in the blood. Like we could see it changing. This is the other one, the kidney image. So this, to me, is, I don't think you could see a better kidney-looking image unless you open someone's body up. Okay? This person came to us, and with so much anxiety, the guy was afraid he was dying. I'm sick. I don't know what's going on. I think I'm dying. And we looked at the blood and we said, kidney? Do you have any kidney issues or ever had any problems? And he was born with one kidney atrophied. So one kidney was alive and one was not. So this showed up in the blood. Chinese medicine, kidneys are the organ of anxiety and fear. So he has one kidney, all right? So he has less than the rest of us. He has less of the tools there to help him deal with his anxiety. So we had to tell him, look, you're not crazy. You need some emotional tools for anxiety. We gave him some breathing exercises and things like that. And then as he started, along with sending him to the osteopath, by the way, but he gets some anxiety these days and he starts to breathe. He does that heart-mouth breathing, the heart-centered breathing, and breathes into his heart, thinks happy thoughts, and the anxiety changes. You know, the kidneys like warmth, so he could drink tea and he's less anxious. So this to me was, you know, when you see images like this, I question what we do all the time. My brother's looked at the blood with my dad for years, not me. All right, I am doing it more and more these days. I was the music teacher forever, but I look at blood and I'm like, is that? Like, it amazes me what shows up in the blood. It's crazy, some of these images. And we keep getting new images. I mean, all the time there's new images. They don't always show up so clearly, you know, but we can definitely tell what's physical, what's energetic, what's emotional. And the nice thing too is with these things, as people are listening that have different issues, the organ for us is almost never the issue unless it was damaged. All right, liver issues because there's compression on the liver. All right, there's adhesions that are pulling and things like that. You can have a liver issue for a few different reasons. You can have a liver issue because of the tooth that's on the liver meridian affecting the energy to the liver. You can have a liver issue because of your anger, which affects the energy to the liver. You can have a liver issue because your body's out of alignment, putting pressure on the liver. All right, that's three things that have taken liver surgery out of the question for us. Real quick, I'll tell you this one, and I'll stop the share for a moment. Hepatitis. So hepatitis, I don't remember B, C. Hepatitis is a virus that attacks the liver and creates inflammation. Virus attacks liver, creates inflammation. So I had a friend come into the office. This is IUD story. Somewhere I have that picture. I wish I could find it quickly. Dad looks at her blood, sees massive amounts of inflammation, sees the liver, and then sees her IUD. So this is where he puts pieces together. And he says to her, IUD? She says, yes. How long have you had it? 7 years. So an IUD, for those of you who don't listening that don't know, for you men out there, IUDs are designed to create inflammation. This is what happens to prevent birth or prevent pregnancy, basically. So she had a device for 7 years designed to create inflammation. She had all this inflammation in her body, and eventually it affected the liver and created symptoms that they labeled as hepatitis. All right? People die from hepatitis. It doesn't go away. So my dad looked at this, told her what he saw. She then proceeded to go to the bathroom and remove the IUD herself, which we do not recommend. Okay? She did this. Dad was like, oh my God. Okay, let's look at your blood again. Much less inflammation. Liver started to change. And guess what? Her diabetes went away. All right? Diabetes doesn't, or her hepatitis went away. Hepatitis doesn't go away. So is it a virus attacking liver, creating inflammation, or is it totally backwards where there's inflammation affecting the liver, creating symptoms they label as a virus? All right. By the way, hepatitis, that's another chronic disease. So today we've cured 2 chronic diseases for people. Lower back pain, get the belly button worked on. Hepatitis, we got to look at your blood, but there's inflammation somewhere. All right. Dad said Danny Kaye was a famous actor a long time ago in the States and went to the hospital, surgery, and eventually died. Complications, hepatitis. No, it was the surgery that created the inflammation for this poor old guy. If he wouldn't have gone to the hospital, would he have died? I don't know.
That's wild. Yeah, it's wild to consider. I remember you telling me the IUD story, and for me, as I've had one, I had a copper IUD. I got it in 2020, and I got rid of it in 2021. But by the end of it, like I had so much inflammation in my body that I was afraid that I had cancer or something like that. And that was part of why I did the
Yeah,
blood test because I wanted to see, okay, is there something that I'm missing? You know,
right.
and what I saw made a lot of sense and honestly like reduced a lot of my anxiety because it's like, okay, deal with some structural issues, get my body into alignment and
Yeah,
the rest will just kind of fix itself. And yeah, a lot has changed. I also find it interesting you had mentioned about taking deeper breaths from the belly button thing. I hadn't thought about this, but right as I got that treatment and I got my blood test was right as I was starting a 28-week breathwork course, which I
oh, interesting.
finished. Yeah, I finished that in December actually of this year. And I did have some pretty interesting, pretty profound experiences as a result of that class. And I kind of wonder, it's almost a bummer to not know what breathwork would have been like before doing that class
Yeah, right.
because, I
Yeah,
don't have that frame of reference. But that's an interesting timing for that sort of thing to
yeah,
happen, and to do
totally.
that thing.
Well, and for us, we border on this airy fairy wooey wooey stuff because there's a lot of interesting science to that. We don't believe in coincidences. So you came and we worked with you and then you started the course. That's awesome. Would it have been different for you without having had that treatment? Definitely.
Mhm.
Definitely. I mean, and it's a funny thing, like I said, there are certain things that are important to us. Oxygen is. Eat, breathe, sleep. We can't live without that. Although I do know there are breatharians who will go for years without eating, which sounds very boring to me. But
Mhm.
breathing, you can't live without breathing, right? So most of us don't get the breath we need, right? And if you go through 80 years of life without getting the right amount of oxygen, it's like your car, without getting good gas for a whole bunch of years, or oil changes and things like that, it's going to affect us eventually. So yeah, that's interesting. I What would have been interesting is like 14 weeks into the course if we had done your treatment.
Yeah.
You know what I mean? Then you would have gone, whoa, weird, because now you can really breathe. And it happens that quickly too. I mean, it's a simple treatment. You release the ligament, and then all of a sudden, you breathe differently. And it's definitely, like looking at you at this point, your face, you look very healthy.
Hmm.
And think about just oxygen therapy in general, the hyperbaric treatments and things like this that people are doing. There's a lot to these things, all right? But the reality is, if our body is efficient, we don't have to do these things. Our bodies are awesome. And if we support them, this is all we've ever done. We used the simple treatments to release the scars, align the body. We would use a few different remedies. We used what was called cell therapy. So, like lung tissue and liver tissue, small, minute doses of it, like a homeopathic, to
Hmm.
help stimulate your system to kick things into gear. The other thing we use were called isopathic remedies. And I'm actually putting a course together with Dr. Marizel Arce. We just did a webinar yesterday. It was awesome. Isopathic remedies, which most people have never heard of, are actually live bacterials and fungals. In the body, those little guys that move around, they will change into bacteria. We create the bacteria within ourselves. It doesn't come out from somewhere else. They will change into bacteria and fungus to help us based on our terrain, our pHs and things like that. And if we do things right, those little guys revert from the fungus back into normal, healthy microzymas or bions. And the isopathic remedies, we actually create them in our body. So I have stem cells and exosomes and cell therapy and isopathics and all that stuff, and I take nothing because I don't have to. I do my homework. I've been to the right people initially, and every day I do something physical, moves the energy. I have the emotional tools, and I believe I can be healthy. That's important. I'm not afraid of germs and parasites and things like that. So this is that holistic experience once again. If you have a physical issue, it affects your energy. Emotionally, we get depressed. Spiritually, you question, why me? If you have a low energy, it affects us physically. Emotionally, we get depressed. Then you say, why me? If you have emotional stuff go on, we get tense. It affects us physically, energetically, spiritually. It's all connected.
Hmm.
And the spirit one is interesting because, yeah, if you don't believe you can get better, there's nothing we can do for you. People would see my dad and say, "Fix me, doc." And he would say, "No, no, no, no. I don't fix anybody. You've been a part of the problem. You need to be a part of the solution. You need to do your homework." The cancer thing is interesting. I'll talk about this for just a moment. Cancer, Mexico cures cancer all the time. Plenty of cancer cures in Mexico. However, most of them, if you do not understand why you got the cancer in the first place, then you get cancer again. But what happens is, well, you went in for your breast cancer and it's gone, they fixed it, and then a few years later, now you've got some bone cancer or some other type of cancer. It's all the same. Cancer is a mold. Your terrain is molding, all right, because of certain circumstances. So when people saw Dad, he really educated them. This is why your stuff is going on. And some people couldn't, for the emotional things, sometimes we're not ready to hear certain things. Dad had the one patient, and his wife cheated on him, and she was with actually the husband cheated on her, and then he was with a younger woman and lived in a small town. And Dad could see this in the blood, that she was very affected by this, and she would say, "No, I'm fine. It's not a big deal." And she never admitted it, and we could never help her.
Yeah.
All right. So the things we can do to help ourselves, and the idea too with what we do with the blood is fun because we looked at your blood. We get an idea. We know you when we see this, right? We talk to you, we confirm, we confer with you. And then if you don't do anything, your blood's going to look exactly the same a year later, 2 years later. We're going to see those things again. But if you start to take those actions, then you get the reactions. Then things start to change. So one of the things we do is we educate and empower people so they can learn to take charge of their health care. So they can go out and be happy and healthy. So you don't have to take supplements for the rest of your life, right? If we're happy and healthy, we get all the nutrients from our food. If there's pressure on the system, the digestive system doesn't work efficiently, we're not getting the minerals we need, now we have mineral deficiencies. Do we take minerals or do we fix the body so the body can get the minerals from our food? It's a simple answer if you ask me. Once you know what you're doing, you do the right thing and the body takes care of itself.
Yeah, I think I like to overcomplicate things. I think that's a big part of when
we love it.
To health.
Humans are strange creatures. We love self-abuse is a wonderful thing, right? And we definitely overcomplicate things. And people love it. I've been seeing all these new scans that people are doing, and there's so much overwhelming information. There's no way to understand it. And then someone overwhelms you with all this information and then says, "Take this." And you go, "Okay." But notice, do you feel better? Do you have a reaction you didn't look forward to? Do they tell you you need to take this for the rest of your life? I don't believe anyone needs to take anything for the rest of their lives, as far as what I've seen. Through my dad's experience, he did this for almost 40 years. We worked with everything from AIDS to zits, like A to Z. Sometimes the system is compromised and you got to do certain things. If the body's broken, we used to say we get the train wreck cases, and one of the last people that came into our clinic before it was shut down was hit by a train. How do you fix a body that's that broken? There's only so much that can be done. But so many things. We have seen miracles and miracles and miracles. And my dad would say, miracles only happen when you know what you're doing. The things that are possible are crazy. When you see Anna's kids, when you see them read without their eyes with the blindfold on, right? Then you have to think about the fact that if there are certain kids who can read without using their eyes, what else is possible? My dad used to talk about studies he had come across of developmentally disabled amputees. So someone whose cognitive functions aren't right, and they lost an arm or something, and the person has to keep refitting the prosthetic limb because the limb is actually growing back until they tell the person they can't do that. And then it stops. Right? This is the terrain. We're part of nature. Animals can do some of these things. Why can't we? We can. I know one person who's got 2 friends that fingers were cut off and their fingers are growing back. Right? I have friends that are trying to regrow teeth and things like this. I believe all kinds of crazy things because I've seen all kinds of crazy things. And it makes me very appreciative of what I have. And it makes me want to take care of it. I have a lot of gratitude for my body. I'm not perfect. Nobody is. We all have our issues. We've had injuries. We've had emotional stuff. We're going to have our emotional stuff every day, all day. But the reality is we have something to work with that can really facilitate and support us moving forward in our lives as long as we support it. So this is our terrain experience. You have questions, you look at nature. You can get a lot of answers there. And if you support the body, it does awesome things. Align it, remove the scars and the adhesions, take care of your teeth, get your damn joy. This was one of the biggest ones. Dad had a patient, he was a prostate cancer patient, and he was a documentarian. I think that's what you call it. He did documentaries, basically. And he interviewed my dad. There's a bunch of clips out there from this. And he said, Doc, what do we do to avoid these things? How do I avoid cancer? And Dad said, the thing that will change your blood faster than anything, change your pH faster than anything, is joy. And it's one of those things that you would think, Dad he wasn't into the wooey experience. There's the left brain, right brain. He was like the numbers guy, So for him to say joy is important with your cancer, that's kind of interesting. But the reality is when we're having joyful experiences, it supports our biofield. Those little sympatrites, the bions, they're energized. We can repair so much easier if we're happy. All right. And it's not easy for people listening. If you're in a state, if you're doing the cancers and things like this, it's not easy to just be happy, but it's important. My dad would say there's only a couple things he would write on a prescription pad, because he wasn't a doctor anymore, but he said he would write joy on your prescription pad. We all need 10 minutes of joy every day. We've earned it, we deserve it, and it's good for our health. All right. So if you guys listening, what do you do for fun? What brings you joy? When my life gets tough, and I have cancer people contacting me and kidney failure and young people and old people and people that want to work with us, people that want to give me crap and tell me I'm stupid. I need to play my guitar. I need to play my drums. And I need to continue to do my work. If my brother and I don't do this, we're the only ones in the world doing this work, then the work will have died with my father. And I think that's one of the reasons he was allowed to leave, was because he did what he needed to do, and now it was my turn, our turn, to share this work with people. And that's what we do. This is why I go where I'm invited. I was thrilled to get to Anarchapulco. People ask us all the time, why doesn't everyone do this? Because not everyone's aware of it. And I'm really grateful for things like, for you doing this, for Anarchapulco, for us to be able to get out, share this, and connect with other people is awesome. The reason people don't know these things is just because they're not aware. So we need to generate the awareness. That's part of my job at this point. Whatever I can do to share this experience. It's not my dad's work. This was work that was given to him to share with the world. So you see what you've been able to do with it. Understand and learn. And you're probably, once you learn certain things, it's like you took the red pill, so you can't unlearn these things, right?
But lucky for us, it's not such a hard pill to swallow of get your body in alignment, experience some joy, breathe, and things like that. Those are way less intense than, okay, you have cancer here, we're going to blast your body with a radiation and maybe you'll survive and maybe you won't. We're also going to tear out some organs and all the other crazy things that they do.
Yeah, right.
Yeah, it's a red pill. I can't unsee it, but it's not necessarily something that, is that you'd want to unsee,
Right. Not everyone's ready for it. And I'm easy, these days. We've come across a lot of people that are excited. I know lots of people. I know lots of awesome people. I had no idea who my dad's patients were, his friends were when we were growing up. So I know lots of people. Not everyone's interested. And that's fine. I am here to teach people that come to me to learn. And that was not an easy lesson for me as a teacher. Mm-hmm. I want to teach this to everybody. I have friends that I could help. I had my one friend in Lake Tahoe. We used to snowboard together all the time. He was such a good snowboarder. He had a knee issue. We said, we can help. He went and got surgery. He walks with a cane now. And he'd call me up and say, hey, come watch a movie or let's play some games or something. It's like, I'm going snowboarding. Sorry. Nothing personal, but he made his choice. And
Yeah.
it's not easy when you see your friends and your family members go through things that you know you can help, and they're not interested. Everyone has their journey, and we need to respect that, allow them to be. So yeah, I was thrilled. It was funny because yeah, Rebecca's awesome, and she, yeah, well, she was like the same thing. She's like showing everybody, look my uterus or something like that. It's like what? Put a picture of the blood, people, right? But yeah, when she said Miranda, I was like, great. When people want to come, if someone can get to see me, where I can actually get their blood live and get them to my local person where they can do a treatment, that's the best thing I can do. We do retreats and things like that. I love it when people come to us because talk is cheap. Let's experience this together. Let's see your blood. Let's have you do some things and let's see what changes. And let's talk about how you feel. I love it. I'm going to do a workshop at Anarchapulco. I can't look at the blood. I can't travel with my microscope anymore because it's a little fragile and traveling is not kind to it. And we need a new one and they don't make our microscopes anymore. But I'll do a workshop. And by the end of the workshop, the 60 or 90 minutes, you feel better. Your blood looks different. It's kind of nice to see it though.
Yeah. Yeah,
That's,
I definitely recommend anybody listening to this too. And I'll put in the description how to contact Adam. And because it is so cool to go. First off, you and Anna both are so hospitable and warm. And yeah, I won't get into all the craziness that happened, but some crazy things happened. And you literally took care of me. And we were doing this blood thing. And it was such a good experience. And I learned so much about it. And I got to see it because you get the report that has the photos and the photos are really high quality and you can see that. But there's another thing to seeing, a happy little blood cell floating across the screen. And it's like, wait,
yeah,
that just came out of me.
yeah.
That's, in essence. And it was so cool. And I highly recommend anybody to do it. It's also not that expensive as far as testing is concerned.
In comparison, the thing is, I get it that not a lot of us have a lot of money these days is one thing, and you can get your live blood done for $50 and then we're $500, but you get what you pay for.
Yeah.
And the way we work, most of the time it's a distance consultation. We send out the slide kit, you stick your finger, get the blood back to us overnight, and we create the report. Fiona will talk to you about it, explain all the pictures, answer any of your questions. And a week later, I get to talk to you. We'll Zoom. Do you still have questions? Do you understand your homework? Can I help you? Can I give you links to people? Can I give you different exercises or tips or tricks? We have so much content and so much information and resources to share with people. We need to meet you where you're at. And then I'm on with people for 3 months. So I'll look at your blood. We'll look at your blood. We'll talk. Then a month later, I want to talk to you again. I want to know what's changed. And you'll love this one. We're such strange creatures. So what's changed? I went to the osteopath, and what was different? Nothing. Okay, well, let's think about this. Did you feel relaxed? Yeah. Okay, so that's parasympathetic. I look at the history form. Oh, so how's your neck was a little weird. Oh, yeah, my neck feels better. Okay, and then, your digestion was off. Oh, yeah, that's weird. My digestion's been better. And you're sleeping? Are you sleeping better? Oh, yeah, I am sleeping better. So this happens all the time. Here's a person who got a consultation, did the treatments, and didn't think anything changed.
Yeah.
Until I talked to them, and they went, oh, shit, everything changed. I had one guy, 3 months later, he'd done all these things, was hilarious, right? And I talked to him, he's like, nothing. And I realized where he's at. Actually, I realized, where he was at with the first month I talked to him, sorry. And I said, I know someone who can work with you. And he said, oh, I've already seen her. And I said, oh? He saw her for a few months. I said, what happened? He said, nothing. Okay, interesting. So then I talked to her, and she's like, oh, really? He told you nothing has changed? Did he tell you that he stopped masturbating and watching porn every day, and that he and his brother are now getting along, and he found Jesus? It's like, no, he didn't tell me this, but we did have the conversation, and his neck feels better, and his stomach feels better, and he's sleeping better. His whole life changed, and he didn't realize that.
Yeah,
So,
funny. That is.
it is funny. This is, I think, one of the great things we do, too, is we help people become really conscious of what's going on. And this is the opposite. With the Western medicine, you take a pharmaceutical, and then you feel no more pain. Well, you're not conscious of the fact that the pain is an alarm telling you something's wrong. It's the same idea of the fire alarm's going off and it's annoying you, so turn off the fire alarm. In the meantime, the house burns down. Duh. Right? So this is how we go through life. I like people, I think we're all doing our best. There's a great quote from Bender the Robot in Futurama who says, well, sometimes your best is an idiot. Right?
Yeah.
But we all try, and I give everyone credit for trying. But, for you guys out there listening, when you go to different people, certain things resonate, right? It makes sense to you. And that's important. When you're talking to someone about going to see them, having a conversation with them first, if you don't really like the person, don't go see them. If you've been seeing, I love this one too. We look at your blood and, it's body work. You have structural issues. And they say, I've got a great body worker. I've been seeing it for years. I love my body worker. Well, your blood told me you need body work. So if you love your body worker, take him out for dinner, but go see a different body worker to work on your body because he's not getting the job done. Right? Food for thought for you guys who love your body workers that you see all the time who don't fix things. Right? So it's, in the end, I'm glad. I'm always happy when we get to look at someone's blood. And when I talk to people, I say to them, look, in a perfect world, you never have to come see us. But I'm grateful that you did. I'm grateful for whatever horrible things you've had to go through, to feel awful, to see these weird, crazy blood people, right? And then as I educate and empower, we take the fear out of the experience. And this is a big deal. I mean, the amount of scans I've seen recently, alternatives, people scans, where there's markers for viruses and cancers and things. It's like, fear. There's so much fear out there. In a doctor, and we've seen this, where when a doctor takes away your hope, that's a big deal for your health and your healing. When you hear you have cancer, most people hear the C word and they give up. And then they die. I had a friend whose mom, cancer in her brain, and they said to the mother, it was November. They said, you'll be dead by December. Well, it affected her brain in such a way that she thought it was November for over a year. They didn't change the calendar on the wall, right? So they said, you'll be dead next month. A year later, she finally realized it was going to be December and she died, right? People would ask my dad, they would say, how long do I have, doc? And my dad would say, that's none of my business. That's between you and God, or whatever you believe in. Because if I give you a date, doctors have a way of making their predictions come true. We believe these things. Lemmy was the guy, bass player from Motorhead. Cancer, dead a month later. Because people here, when they get cancer, they die. Sometimes people get cancer and they go, screw this, I'm not dying. And they start living. And the cancer can go away. All right? If it's a mold, you cut the mold out of the cheese, and 3 days later, there's mold all over the cheese. You got to rejuvenate the cheese. This is why joy is important for us. All right? It's the little things in life, Miranda, the little things in life on both sides. That eat away at us and that build us up too. Like
the old phrase that we keep as a core tenet of Anarchapulco, keep it simple, stupid.
Yes, and the KISS principle. And what we've done is we've changed it. So Dad says we do the KISS principle with you. We want to keep it simple and sustainable because we don't want to call you stupid. Keep it simple, stupid. Come on. Yeah. Keep it simple and sustainable. And it's like I said too, Dad said health is simple. People are complicated. Align the car, remove the scars, and work with the adhesions. Work on your teeth. Get the mercury out. No root canals, things like this. Align everything. Get your energy to flow. Have emotional tools because emotions are going to hit us all day, every day, and believe you can be better. And don't kill your parasites. I think I'm going to do a puppet. Pete the parasite. Why is everybody trying to kill me all the time? I'm just trying to help. Well, we'll do the kids' books and we'll help with the kids and they'll never kill their parasites. It'd be awesome. Pete the parasite.
Okay. All right. So I have one more question for you and then I'm going to let you go. And that is, what are you most excited for with Anarchapulco this year?
Good question. Anarchapulco, for me, when we got invited by Rebecca last year, I was thrilled because we don't get invited to a ton of things, okay? To bring the family, awesome. To get Anna to be exposed, to this Western world as well, because Anna is very famous in Spain and Europe. You know what it was? It was the people. The people at Anarchapulco are awesome. You know, I knew nothing about crypto is one thing. I just think money, you know, and I don't have money, so money, whatever. And then health, it seemed ironic to me. Money and health and weird, but the best part for me was hanging out with the people that were there. You know, for me to get to just hang out with Andrew Kaufman and ask him questions. You know, for me to get to hang out with random people I'd never met before, who had seen me before. I made friends there that were awesome. You know, what Scott and Leora from Winsome Kind, the band, you know, great fun. And then I do my presentation. She's crying because there's something with the family and there's something that makes sense. There was a doctor there that came to us and was really interested in what we do. Even what's his name, the doctor that owns the property, he came over to us, you know.
Yeah,
we met interesting people that are not just talking about things, they're doing things. They're taking action on things. So that's, you know, for people thinking of going, you got to do it. You got to do it at least once. And sorry if the guy mowing the lawn is getting loud, if you guys can hear that. Timing is everything.
But I mean, especially with the whole you got to do it thing, the thing with this year is that we're starting to let people know is this is the last year in Acapulco. We're going on the road to other parts of Mexico after this year. So if you've been thinking about coming and feeling the vibes of Anarchapulco as it originally started, this is going to be your last chance, probably for a long time. I'm not saying we'll never go back to Acapulco again, but I am saying that we're moving out of that city and going elsewhere in Mexico next year.
Which is great. You know, I think for you guys to spread this stuff around is awesome. You know, the fact that you just did, where'd you do the last one? Where was it?
It was Liverpolco and Liberland. Well, it was in Serbia, but it was for Liberland. We partnered with them. Yeah.
Yeah, awesome. I mean, you're generating awareness in different areas. I think that's great. So that's wonderful. So for people waiting, hoping it'll come to their area, maybe it will, maybe it won't.
If you're in Mexico.
You're in Mexico.
Because that was a question somebody had asked me earlier today. Is like, is it going to come to the United States? And I'm like, well, considering that Jeff started the event saying, why are all these freedom events in the United States? Let's do one in Mexico. And that's how Anarchapulco was born. Probably not, you know, but
it's probably not the right place for it because they'll probably want to shut it down or regulate something. And
Yeah, you know, and there's enough. You've got Pork Fest, you have Music and Sky, you have all these options that are already in the United States. And no, I see us, and we've had people begging us for years, like, hey, we want to see different parts of Mexico. And then there's me, you know, I've got my own bucket of trauma associated with Acapulco, and I'm like, please stop making me go back there.
Right, that's funny, yeah. Well, that's cool, and I do, for people that are watching and listening, I think it's awesome. You know, if this is the place that originated, if you want to see, like, I think about things like Burning Man. Like, if you wanted to go to Burning Man, you should have done it 10 years ago. 15 years ago. So this is evolving, which is great, but at the same time, if you want to see the roots, if you want to see what's really gone on, where it started, then this is the place to go.
This is the place, and this is the time.
This is the time, right. And besides the fact you get to hang out with me and you, you know, we hang out there, which is fun. You know, I appreciate that. I've been to events where, you know, the speakers disappear. You know, I didn't disappear. We hung out with the crowd the whole time. You know, I mean, it's nice to disappear sometimes because sometimes you just want to relax and shut up and don't talk about cancers and things like that. But it was really a nice, coherent, cohesive experience. You know, we saw the same people repeatedly. We got to know people's names. The kids had a blast doing their whole experience. There were places to disappear if you needed to. You know, after hours, even hanging out at the bar was fun. I'm not a bar guy, but to go hang out at the bar with Steve Falconer, you know, cool. Max Egan, you know, interesting. The conversations were definitely not about the Charger game, you know, or the football games or the weather and stuff like that. These were interesting conversations, without a doubt. So I'm excited. Anna's excited. We're thrilled. You know, I look forward to this. I think the weather is a little warm, which is kind of nice in a way. You know, you got the pools, the food was awesome. I think the way you guys have things set up, you know, where there's always something to do. You know, I think it's awesome. I'm thrilled to be invited back. So yay.
Yeah, I'm excited to to have you back, especially after getting to know you and Anna so much this year, in that way. And yeah, for me, I've had people ask me over the years, like, especially, when they watch the series and they see how much trauma I've experienced in my time in Mexico, they're like, why do you keep being with Anarchapulco? And I also
Right.
have that moment where I'm like, why do I still do this? But then when I'm actually there, I'm like, this is why I do this, is so I can have this awesome week once a year with it's like a family reunion for me, That's the
Nice.
one chance I get to see everybody.
Yeah.
And it's absolutely, absolutely worth it. And you get to build a worldwide network. I have people on pretty much every continent there
Yeah.
I can go to and be like, I can stay with them. I've
Yeah.
had people invite me all over the world to come stay with them.
Awesome.
Yeah,
Yeah.
doing these sorts of events.
Totally. Yeah, I'm going to go to Denmark someday and I'm going to hang out with Steve Falcon. I'm going to play some music with him in that Irish pub. It's going to be awesome.
Yeah, and
Would
I'm going to
we?
go to the UK and I'm going to stay with Sam Pilbeam, from that.
Awesome. Yes, Sam was awesome. It was really, people came from all around the world.
Mhm.
I mean, we met people from everywhere. So it was really, and this is interesting too, because with the world I'm in and the work I do, I can't not talk about this with everybody. I have friends I don't talk about this with. I have extended family that thinks we're crazy. So to be in a place with a lot of like-minded people is very nourishing.
Mhm.
My blood looks better doing these types of things, right? And it's funny because if you got that woman bringing her microscope, maybe I can use her microscope for a moment. We can do some blood and see the effects of pre and post Anarchapulco.
I mean, she seems friendly enough, and I get the instinct that she would be open-minded. Like, she's
Cool.
been very easy to deal with. She's been very friendly, very straightforward. And yeah, these random people that are somewhat, indoctrinated on Instagram with all their followers, of course, they're going to be resistant. But I think that anybody doing those live blood tests that are worth anything are going to look at the experience that you and your family has and respect it and want to learn from it, not shun it.
There's a lot of the live blood courses you'll learn about our work, but part of the problem is it doesn't work both ways.
Hmm.
There are things that they talk about that they're just wrong. So we've had live blood people take our course, but you can't incorporate the two depending on, which is interesting. And the thing is this, I don't even doctors, anyone that's a doctor these days, they want to help people. And maybe they want to drive a Porsche and golf on Wednesdays, there's nothing wrong with that. So I don't blame doctors. The live blood people, they went to learn something to help people. They don't realize that I had one from UK come to see us. We trained her and she said, I've been doing this and I realized I'm not getting results. And then I just realized that I work with all these people and they just stopped coming to me. Like she, over a period of time, realized it wasn't working for her. So that's when she said, I want to know. And she reached out to us, which is great. And to me, I think anyone that's doing live blood is geared to do what we do. The unfortunate thing with any practitioner in general is we get the ego thing involved. I have my tool, I have been trained, and I know what I'm doing. And it works. Okay, does it work or not? Why does an antibiotic work? An antibiotic masks your pain. So it does that, but you don't realize, most Western people don't realize that antibiotics don't actually help you. They help you with the pain and manage that, but it pushes things deeper. So I'm easy too. I am practicing non-judgment as much as possible these days as a human being. So like I said, we're very interesting creatures. We love to judge everybody. And I'm open, so I'm curious, definitely. Time will tell, we shall see, right? But I like to think that if it was me, if I can do my best to put myself in anyone else's shoes, which we can never truly do. So I got a microscope, I learned there's cool things, great, awesome. And then there's more. There's always more to learn. So I would be thrilled if someone came around me, if I learned something and they had more to offer, I would be very curious and interested.
Yep.
It can be overwhelming for people depending on, but I'm easy. So I'm curious. We'll see. We shall see. There is a local guy in town here where I live, who claims to be the premier live blood analysis guy in all of Mexico. And he tells people that my father was demented. So let's forget
Okay.
about the fact that he changed medicine in the United States and he cured many, many people of cancer for decades. You can think he was demented if you want. Was he crazy? Hell yeah. It wasn't normal. Right? That was normal. Being normal, that's crazy. But good stuff, Miranda. I appreciate you having me on. It's really nice, like I said, to do this with you because you've been through our experience. And it's funny because even as I look at your blood real quick, because your report finally came up, the trauma that you went through that most people are aware of because it was televised did not show up in your blood.
Yeah, but I've more or less, that it's not something that I think about for the
Yeah.
most part. Yeah.
It's what that tells us is whatever's going on with you, you have been able to process that because that stuff will show up in the blood. So that's extra points for you. And when we wonder about ourselves, am I as grounded and centered as I think I am? I thought I knew how to relax until I moved to Mexico.
Yeah.
And when the internet guy shows up mañana and mañana is like 2 weeks from now, what do? You relax because you can't push. Mexicans are funny. They're like this non-Newtonian substance where the more you push, then there's resistance, so you don't push them. And then things happen. So I thought I knew how to relax. Yes, I think I'm grounded and centered. But extra points for you because what you had gone through as I watched part of that series and turned it off at that point because I didn't want to see what you went through.
Yeah.
That was a lot, and I was curious about Anarchapulco. I had people that were involved previously and they mentioned things, but I expected to see that in your blood without question. So whatever's going on with you, you were able to deal with it pretty well.
Yeah, I think living in Mexico is a big part of that because on the joy thing, like I was able to find small ways, and this is, as a result of my friends, I was able to find small ways to experience joy, even just a few weeks after the murder. And I was able to really take time off and get therapy and like decompress while I had some friends supporting me financially there for like 6 months to where I could really check out and deal with some shit, and it was not easy, but like I'm definitely not what I would say like emotionally damaged or scarred or anything.
I probably would be, but yeah,
And
just
I mean,
because.
most people would be, and most people are like, "How are you this okay?" And I'm just like, I'm lucky, I'm lucky. I have good people in my life, but for the most part, like I've treated people well to where the reason people were willing to help me is because I, was a good part of their life and still am,
Yeah.
so.
Yeah. And I'll tell you this, I don't believe in luck. I think it's all meant to be. So you earned, part of it is even, when people come in for short time, there's contracts, and this is whatever went on with you. Had that not happened to you, would you be where you are now?
Well, that's how I feel about it. Like I use the word luck, but I also use the definition of luck is what happens when hard work meets opportunity. That
Cool.
it's I like the word luck, I think it's fun to say, but
Yeah.
I
Yeah.
also there is, that sort of thing to it. It is and there were many years where I was like, well, not even many years. There was like 2 years where I was like, poor me, this sucks. Why did I have to deal with all of this? Why do I have to deal with these legal problems, all of this?
Yeah.
But really this year I kind of sat back. I worked, I kept up with my responsibilities, but I also focused a lot on enjoying my life and really looking around. Like I have an apartment that is really comfortable. I have a good cat. I have an amazing partner who treats me like an absolute queen. I have and my circus family. I have so much that's good in my life, and I've just been trying to enjoy that, and that's what it's really all about. That's
It is definitely. I don't think you would have been as lucky if you were not a nice person. If you were a turd, basically. So that's a lot there too, right?
some people definitely thought I was a turd, but there were a lot of people in the movement that knew, like a lot of the people that really helped me were people that were very close to me and were seeing that, the person barking all over social media was actually my ex using my social accounts. And some people got close enough to me to know, hey, she's actually the one that's doing all of the work and taking care of all the animals and running the businesses and making all the money and surviving down here. And this guy's just kind of not being very nice to her, we'll put it that way. And so these people, when push came to shove, they were like, I know if I help her, it's a safe bet. And, in a couple of weeks, it'll be 6 years since the murder has happened. And
Wow.
my life is completely different. Like watching the series, I rewatched most of it a few months ago, like 2 months ago. And it was startling to see. I looked like a skeleton. And and a lot of people, theorizing, oh, she's definitely on meth. Oh, she was definitely on heroin. And honestly, had I been watching the series, I would have thought the same thing. I was covered in sores. I was very skinny. I was very sickly.
Sure.
And it was all just stress and basically really stress because, it was just like, it's
the life you were living. Yeah. And it was funny too, because when we were at Anarchapulco and I didn't know that was you. It's like, and then there was a point in time where I said to Anna, it's like, I watched the series, and I told you when I stopped, and she said, yeah. And I said, I think that's her. And then you guys started to talk about it, and Jeff was telling people, it was like, oh shit, excuse my language. Oh, damn it. It was like, wow, that does not look like the same person.
It's not like, it's to the point to where I look in the mirror every day and I'm just kind of like, who is this person here?
Yeah, that's funny. Where did this pretty girl come from? Huh, weird. I think it's cool as hell. And I really, I think it's important for all of us to appreciate everything we've gone through. Good, bad, and ugly. It's a part of what helps us to create who we are. And I haven't had the best experiences. I've had awesome experiences. We've all had our crap for sure. But at this point, I'm really happy with where I am now. And I wouldn't want to change any of that stuff because I might not be at this point. Maybe I'll be in a better spot. I don't know, maybe in a worse spot, but I'm good here right now. Yeah. So I appreciate all that I've been through. And I'll tell you this, one of the last things we'll say is I watched a video once of a woman who talked about having a near-death experience. And she said she was drowning, basically. And as she was drowning, she said, okay, I accept this, God, Jesus, whatever, protect my family, and I'm okay. And she heard the voice say, everything's going to be fine. And she felt a sense of comfort. And then she saw her life flash before her eyes. But she said it wasn't like in the movies. What she saw was every horrible instance in her life and the chain reaction of how it turned into something awesome. All right. So for people watching, listening, we're going through stuff, all of us. There's reasons for it. All right. How do we react? What do we do with these things is a whole other story. But know that life happens for us, not to us. All right. The cancers made total sense with my dad. People that get cancer, there's definitely reasons there. The blood can help us figure that out without question. Then it's also a question of whether or not the person's ready to hear what they need to hear. So for all of us listening, align your damn car. Take care of the adhesions and the scars, get your teeth fixed, things like that, and get your damn joy. Have those emotional tools, because life is going to happen to us every damn day, and you never know what to expect. And you know this, when you're down, life hits you a little harder, right? Yep. So we need to be an active part of that. And if we can do that and see and accept and see where we're fitting, it's a lot easier.
Yep.
It's a lot easier.
I agree 100%. Well, thank you for taking the time to do this. I'm really excited to get this up on the channel and to start sharing this with people. Because it's also, for me, it's my own secret way of sharing my blood story.
Yeah. Oh, yeah. That's true. Yeah. Well, and it's funny because I have people that come to our webinars and things like that. And it's like, I'm talking about you, but we're not mentioning names. And sometimes people say nothing and sometimes they jump right up. It's like, oh yeah, that's my prostate and blah, blah, blah. It's like, whoa, I didn't expect that, But, the thing is this, we learn through our own experiences more than anything, right? But to see someone go through something is very powerful as well. You know, you are a living example of what we can do as far as being involved in some real trauma, you know, and then changing things and turning things around and being awesome, being the best we can be without feeling like we're the victim and poor me and whining about it. You know what I mean? We're allowed to be sad and frustrated and whine at certain times, you know, but the reality is this is our life. My life is mine, yours is yours. I have to live mine, you live yours. You know, and we'll project our crap and we'll not hold ourselves accountable. But if we can just look at ourselves really objectively and appreciate our good, bad, and ugly, then we can be okay and we can move forward. You know, I don't think it's not rocket science, this whole experience. But we make things so complicated, it's ridiculous. Get over it, people. Relax. Don't hold on to your crap, right? Because it eats away at us, right?
Yeah,
Let
it's
it
just
go.
serious. Yeah, let it go. Chill out. And if you have somebody like me saying it's not that serious, just get over it, you know.
Right. If you could say that, right? Uh-huh.
I
And
think
it's even when I'll have the cancer patients, you know, that used to have cancer, and they can tell you the same thing. You know, when it's that the C word, you know, they made the show about it. It's like, oh, you got the C word. All your friends are going to feel bad for you. Poor you. You're broken. You're damaged. Or not. You're going through something and you have a lesson to learn, and it's time to get your head out and hold yourself accountable. Change
Mhm.
the lifestyle if you need to. Or not. It's up to you. It's your life.
Yep. Well, thank you again. I'm gonna go ahead and end this and then we can get to the rest of our day.
Awesome.